So this guy just got in from St. Louis, is going to Cincinnati tomorrow, I think, and it continues on. So we are stop number whatever on the International Single Payers Anthem, and I'm going to turn it over to Timothy Faust.
Sorry, I'm running a little bit late. I forgot how time zones work, and I had a paper due because I'm still in grad school. And it turns out being on the road all the time makes it really, really hard to write papers because I can't type and drive very good. But I'm here now, and I'm happy to be here. Never had a beer in Kentucky before, so I can put it on my big map of stars. I'm very, very happy to be here in Louisville. Last time I was in Kentucky, I drove through some of the backwoods. I think it was Trump had some sort of like big to-do, some kerfuffle in Cincinnati, so I wanted to avoid the highways. So I got to drive through a lot of the highways and byways of Kentucky, listening to my favorite ever metal album, which is called Kentucky. It's a black metal album about the coal miners' strikes. Panopticon, it's a fantastic album. It is, if you don't like black metal, but you like socialism or you like unionism, it is a fantastic album for you, but I'm glad to be here because this is a place I was really excited to come to. So thank you all for having me. I'm on this big, really sweaty road trip to go talk about single payer. I want to hit every state in the union by middle of next year, and I'm on track to do that, much to my girlfriend's chagrin. A lot of time on the road, but it's good, right? And so I have a little spiel. I think we're going to do Q&A about healthcare policy, about tactics, about single payer, about whatever y'all want to talk about. So please give me some cues that I can A, but then I will also have cues for you to Q A. Sorry, letters are complicated. I'll say this later, but even though single payer and health justice is a big national fight, healthcare needs, right, and health justice is inherently local. Right, one of the things I've been able to learn as I kind of travel around the U.S. is how healthcare and health justice manifest in different parts of the U.S. For example, I was in Albany, or possibly Albany, New York, I don't know how to pronounce it, where you've got a pretty sharp, like the town of, or the city of Albany, and then the rural areas right to the west, and the opioid epidemic has just cleaved the entire county right in the middle. So you got folks in trailer parks, and folks like in the university, and folks in the Capitol, and all of them have been split by how opioids have affected them. I was in the Upper Peninsula of Michigan, up in Marquette, a town of 20,000 people, 10,000 when school's not in session, where over the past 20 years, community health centers and primary care clinics have closed down. Just one hospital left in the region, and it's run by some dipshit CEO in Tennessee. And because there's no other place for people to go, they just kind of pile into the hospital because there's nowhere else to turn when you get sick. And so nurse to patient ratios are like 1 to 30 or 40, which is not good. People are working 70 hours a week, and so all the nurses went on strike. And then the entire town came out to support them. So you've got literally an entire town, including some of the cops, and I don't like cops, but even they're showing up, against a capitalist in Tennessee. I was in Indianapolis, where outside of Indianapolis and Allen County, we have a brand new epidemic of HIV/AIDS, a condition that we know how to treat. And the reasons for that outbreak are, you got a couple different vectors. One, you got big pharma trying to retain their copyrights, making drugs no longer crushable, but only injectable. It's people who are using opioids and inject it. You got then Governor Mike Pence shutting down all the needle exchange programs, so folks have no clean resources to use if they're going to inject. And then also you have the shutdown on the legislative side of a bunch of community health care centers and Planned Parenthood. So the result is a bunch of people who are battling addiction are now only able to inject it. There's no needle exchange programs. There's nowhere to go. So HIV/AIDS is back in one of the poorer counties in Indiana. And then, of course, because they have a robust school choice program, all the rich kids send their kids out of the county to go to school. So the school is now a school primarily for poor kids whose parents are on the system. And so I spoke with one of the guidance counselors in that school district. That's like a kind of getting and storing all these different kinds of healthcare and how healthcare happens across the U.S. is important to me. So I'll talk about this later, but at the end, I hope y'all will share with me kind of what y'all see and happen in healthcare in Louisville and across the rest of Kentucky so I can understand better what it is that we're trying to fight for. That makes sense? That's enough preamble. I'm here to talk about healthcare. Do y'all want to talk about healthcare? Great. I want to talk about where we're at now, who it benefits, and what we want instead. I want to tell you why we're told we can't have single payer, what we have to accept in its place, why that's wrong, and what we need to do to realize health justice in America. That sound good? That arc palatable to y'all? Yeah. Very good. Let's start by describing what we got now, right? Let's define the contours and the shape of the enemy. Right now in healthcare, you got a bunch of payers and a bunch of providers. Providers are folks like doctors, nurses, hospitals, physical therapists, drug companies, the dude behind the counter at Dwayne Reed who sells me my inhaler or Tylenol or whatever. And when someone needs healthcare, the provider provides it. That makes sense. That's why they're called providers. By and large, the costs of receiving healthcare are much, much more than any individual person could afford by themselves. But in a given year, not a lot of folks need healthcare, right? In a given year, 50% of all costs come from 5% of the population. 80% of all costs come from 20% of the population. And those costs are like not consistent from year to year, right? Maybe one year you get hit by a car, or you have a scare with cancer, you give birth prematurely, and the next year you don't, right? So those costs kind of jump around. But no matter how you slice it, by a person's age, by their gender, by their race, even by whether or not they have a chronic condition, some folks have a whole bunch of medical costs, and a lot of folks don't, and a couple of folks are in the middle. And so if we made everyone pay for all of their healthcare costs out of pocket, millions of people would go into crushing poverty. It's not a guess. We know that. That's how things used to be. That's what happened. And it wasn't until a bunch of socialists and unionists in the 1880s insisted that letting people go into lifelong poverty because of medical debt wasn't acceptable that we shifted to a new payer model, the idea of insurance. Now, insurers are companies, right? And they receive revenue by charging you monthly premiums. When someone gets sick, insurers spend the money they collect from everyone to pay a portion of those healthcare costs, although you're still on the hook for some of it. Then they keep a profit for themselves. And so the more revenue an insurer receives from its customers, or realistically, the more subsidy it receives from public money, the wider those costs are spread, and the lower the insurer's per-person costs. But if an insurer has too many sick people, right, its costs increase, and then it's got to raise its premiums to keep up. But when premiums go up, people that can't afford the premiums drop out, except for folks that are already sick because they got to stay on. So per-person costs keep going up, and then insurers got to keep raising premiums, and it builds this big, vicious, gnarly cycle. Thus, an insurer wants as large and as healthy a customer base as possible, or it wants to find ways to kick out sick folks or coerce them into not joining insurance plans in the first place. That's what we mean when we say that we live in a world in which healthcare is a commodity, right? Because future's on your lungs and future's on your heart, and whether or not you get diabetes and whether or not your Meemaw's glaucoma gets better or worse before age 65 and she goes on Medicare are bought and sold for profit by private companies. Now, in this world, we've made paying for healthcare is very complicated, right? Because payers don't all pay the same prices for the same kinds of care. Some payers pay more, some payers pay less, and some insurers don't pay anything at all and pass the bill back to you. That sucks. And so this fragmented, commodified healthcare model views healthcare as a transaction that only happens when you're insured, instead of a relationship between a person, their body, and their doctors. That's perverted. We have mistaken the profit motives of insurers for healthcare. And over time, we've delegated the responsibility of providing insurance to employers. But that's messed up too, because that results in a status quo of total employer domination, in which your access to things like contraception, or blood transfusions, or hormone therapy are determined at the whims of your employer. But if you aren't lucky enough to have an employer, right, if you lack the better skills to get the finite number of better jobs, you're left behind. And so the people who profit from the commodification of our bodies have decided it is acceptable to shackle the well-being of children to whether or not their parents are lucky enough to have gone back in time 40 years, learned how to code, and found a benevolent employer. Welcome to the hell world of America 2017. I don't know why you're clapping. That's super messed up. And of course, it gets worse, right? Because the costs of healthcare keep increasing. And the costs of healthcare have been increasing since we first began recording them back in the 1880s, and they increase faster than inflation. Now, part of that's for good reasons, right? Folks can now live longer if they have a chronic condition, right? Things like cancer or a heart attack or diabetes aren't the immediate death sentences they were even 2 or 3 generations ago. That's a pretty good way to spend money, taking care of folks longer. But a lot of these cost increases are because hospital CEOs and pharma companies, close personal friend Martin Shkreli, are finding more and more ways to charge money for the same kinds of services, or rack up fees for unnecessary services, and no small private insurer, won't somebody please think of the insurers, can hold a candle to them. Here's how that shakes out. In the US, the average procedure costs 40% more than that same procedure in France. Over a third of antibiotics are unnecessarily prescribed, which is bad for two reasons. One, that's a lot of wasted money, and two, if you overprescribe antibiotics, you get antibiotic-resistant bacteria, which are an entirely new world of unimaginable pain, also very, very expensive. But most egregiously, think of MRIs, right? Y'all know what MRIs are? MRI is a big machine that just prints money. In the US, the average MRI procedure, same machine, same procedure, push button, costs 5 times what that same procedure costs in Australia. Same machine, same procedure. Now this whole ecosystem scares the bejesus out of everybody involved, right? Particularly the payers. Payers are interested in finding ways to mitigate rising costs. Sometimes that means refusing to pay for claims. You've all heard those horror stories. Maybe they've happened to you. Before the ACA, it often meant that payers would refuse to cover somebody who was or who was likely to get sick. Y'all know the phrase pre-existing conditions. But this still wasn't driving costs down. So we all in America got together in the 1970s and invented the idea of consumer-driven healthcare. It's the idea that you should make consumers, which is just a libertarian way of saying people, pay more for the costs of their own health care, right? Because when you're on the hook for your own health care costs, you turn into a smart shopper somehow. And through the power of the free market or whatever, you shop around and pick the least expensive emergency room. If you get hit by a truck, you don't get unnecessary or expensive care, and you like Yelp your surgeon or something. And all this together will drive prices down. But all this builds, besides being really wrong, builds an atomized, isolationist, and honestly pretty lonely worldview of what healthcare is and what healthcare can and should be. It treats being sick or being poor or being able to get pregnant as a character flaw. And that means if you get hit by a car, or you give birth to a premature baby, or you get rabies, you're on the hook for your own costs because it's your responsibility, right? Because healthcare is a matter of personal accountability. And if that accident, or if that illness, or if that pregnancy forces you into a lifetime of crushing medical debt so that a hospital, a pharma company, or your insurer can turn a profit, well, tough shit, man, that's your problem. Wow, that's a pretty bleak worldview, right? But here's the thing, and you already know it, it's a big load of horse shit, right? No, when people are forced to pay for their own healthcare costs, they just don't seek healthcare. I don't mean catastrophic care. You get hit by a semi. I don't know why I keep saying that. I'm driving all over the place. It's terrifying. It's kind of forefront in my mind. When you get hit by a truck or whatever, you're still going to the ER. You're still seeking catastrophic care. No, folks that are forced to pay their own unaffordable health care costs don't get primary care. They don't get preventive care. They ignore that rash. Try to not look at that growth or think away that chest pain. Because we demand people bear the burden of expensive healthcare costs, they turn their bodies into ticking time bombs until they have a heart attack and die at their jobs and leave their kids behind. Consumer-driven healthcare only serves the people who seek to extract profit from our bodies. And so, every single year, labor unions are forced to fight corporations for worse and more expensive insurance instead of being free to organize around better wages, better contracts, or workplace safety. So what do you do, right? How do you square the rampant increase of healthcare costs with the fundamental fact that insuring sick people just isn't profitable? Well, if you're the Democrats, you collaborate with the Heritage Foundation to offer us the Affordable Care Act, which, as our friend comrade said before, is just the general subsidization of private industry with public money. It's a plaintive wail, right? Please, 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 pretty please, how many billions of dollars do we got to give you before you stop kicking sick people off their insurance plans? Now, the ACA, of course, had some pretty unequivocal successes, right? First and foremost among those, the expansion of Medicaid. In counties where Medicaid was expanded, it led to a 6.1% decrease in the mortality rate among those enrolled, right? That's a 11.1% among people of color. Now, of course, that's because these people have been systematically marginalized and violence enacted upon them through decades, if not centuries, of the way health care or even general basic rights are appropriated or allotted or permitted. But still, like, improving people's quality of care, even like the nascent beginnings of a Medicaid program, is unilaterally good. That's great. The ACA also normalized the idea that denying someone care because of a pre-existing condition is cruel, or at least normalized it among folks that get to be on TV. I think everybody else kind of had figured that out intuitively to begin with. And the ACA also defined the idea of essential health benefits, which compose a minimum standard for coverage, right? An insurance plan that covers a nickel of $1,000 of healthcare costs is barely insurance to begin with. But at the end of the day, right, costs keep increasing, quality of care stagnates for the most vulnerable among us, and 28 million people are still uninsured. Thus, the Affordable Care Act has failed in its pursuit of health justice. So instead, we demand something much simpler, right? We demand a federal, universal, single payer. Single payer is a pretty simple concept, right? Instead of having a bunch of insurers with fragmented customer bases, each kind of seeking to pass the buck and avoid taking care of unprofitable sick people, we have one publicly owned, publicly funded insurer with a legislated mandate to cover in full all care for all people. All care for all people. And, well, yeah, hell yeah, man, that fucking kicks ass. We know that everyone benefits when accessing care is affordable or even free and easy, right? Because delivering care, being a doctor, being a nurse, being a therapist, that's hard, that's complicated. But paying for it's pretty simple, and in fact, we're already paying for it, right? We're just forced to spend that money really, really stupidly. American public money pays for 2/3 of all healthcare costs in the US right now. Half of that 2/3, aka 1/3, is direct federal spending on Medicaid, Medicare, and the VA. The other half of that 2/3, aka another third, is just government subsidies to private companies. The remaining third is additional money that you pay out of your pocket, right? Premiums to insurance companies or out-of-pocket expenses to hospitals. And so the goal is not necessarily to reduce spending, right? Although your per-person costs would plummet under a single-payer plan, but to reallocate it to take care of everyone long-term. We know that Medicare negotiates much better prices for treatment because it has 44 million people enrolled nationwide, and therefore bargains on their behalf, instead of a few hundo thousand in a given state or a few 10,000 in a given city or county. And so you scale that idea up, and you build an improved Medicare for all. Fuck parts A, B, and D. You merge them all together, build one comprehensive Medicare for all that guarantees fair prices for care nationwide. Here's how, oh hell yeah. Here's how it looks in day-to-day, right? Right now you go to the hospital, you go to the clinic, you call the doctor, and the first thing they ask you, sometimes even before your name, that happened to me literally 4 days ago, is what's your insurance plan, right? How are you paying for this? We have this big dumb octopus we've put in the middle of you seeing a doctor, in which your insurance company has to get in the middle and say what they're paying for or not paying for. Nurses have to go back and forth with claims adjudicators determining what is and what is not appropriate care. Hospitals have giant billing departments. All this adds up to $380 billion per year in unnecessary administrative costs that the insurers keep or turn into profit, right? So instead, under a federal single payer, you go to the hospital and this question is moot because we already know who's paying for it. It's the Medicare for All program. We don't have to fucking worry about what's covered, what's not covered, because all care for all people is covered. So when you go to the doctor, the first question they can ask is, what do you need, as opposed to, how are you paying us? And also it saves, again, that at the very, very least, just for the fucking beginners, $370 billion per year. So what do we do with that money saved? Well, we reinvest it to improve everyone's standard of care nationwide. We build primary care clinics in rural areas that have been shut down for the past 20 and 30 years. We fund community health centers in poor neighborhoods, and we return that money to the people that are doing the work. Take, for example, y'all know home health aides? If you ever have like a sick parent, a sick kid, a sick sibling, sometimes you can get care in your own home, right? You don't need to be in the hospital. So it's a basic transfusion, basic procedure, physical therapy, and that's great because being in the hospital costs about $10,000 per day, which is why hospitals keep building more hospital beds. Also,
like $9 an hour, man.
Pardon?
They make like $9 an hour.
You just are one bullet point ahead of where I'm going. I'm very excited about this. But But when you're at home, right, like home is where your dog lives, home is where your computer is, it's much, much easier to receive care in the comfort of your home. It's more humane and it's cheaper. So everybody benefits from home health aides. There's going to be 1.2 million of them by 2020. Well, everyone benefits, except for the home health aides themselves, right? Because they're billed at an average of $153 per visit, but are only paid in the US nationwide $11 per hour. I guess in Kentucky, $9 per hour. So we can allocate this money to do what the private market won't, which is pay fair wages for essential care that helps everyone. In the Q&A, remind me, because I've got a whole bunch more ideas for how we allocate the money to put more folks in jobs that help people. There's a lot of shit in this that I'm very excited about, but hadn't written down in this speech. Right now, right, your private insurer only bears the costs of you receiving care right now, right? Because they're going to change insurance plans in the next couple of years, probably, and eventually you go on Medicare. Insurers don't feel any pressure to provide you with care that keeps you healthy in the distant or even near future, right? Instead, we all do, right? Because we all suffer when our friends and family get sick, and our public money is allocated to care for folks in time of crisis or times of catastrophe. Because insurers have this fear, right, that if you make accessing healthcare cheap or even free to people that are using it, people might use more of it, and that's really hard to make a profit off of. So it makes perfect sense that the same actor who suffers when people don't get care, right, which is all of us, united, represented by our federal government, should be the same actor that pays for that care in the first place. Because once the federal actor bears the costs of providing health care and the risks and costs of not providing health care, it can finally be a tool for realizing health justice. If people are getting sick and dying because they don't have a place to live, or the places they live are unsafe, they're full of mold, they're full of pollution, they're flammable, I'm thinking of a ghost ship in Oakland or the Grenfell Towers in the UK, then housing is healthcare. And you build free or affordable housing to bring healthcare costs down. If people are getting sick and dying because they don't have access to healthy food to eat, because it's not profitable to sell a poor person vegetables, and so they're getting diabetes, which leads to cardiac failure, then food is healthcare. And you provide folks with free or subsidized food and the time, space, and materials with which to prepare it to bring healthcare costs down. That's fucking right. If your people are getting sick and dying because they don't have access to needle exchange programs, therapy, or counseling, then rehabilitation is healthcare. And you build full cycle addiction treatment programs. Not the fucking like end of life palliative care prevent death bullshit, but the full social safety net required to help folks handle addiction or not seek it in the first place. And that's how you bring healthcare costs down. Because single payer, right? Single payer is only the tool, but health justice is the goal. And when we fight for health justice, we all fight side by side because economic justice is health justice. Environmental justice is health justice. Reproductive justice is health justice. And justice for black lives, justice for trans lives, justice for the lives of immigrants, and the well-being of all people, regardless of age, gender, race, or creed, that's health justice. We have inherited a world in which your permission to receive health care, right? Capital's allowance that you can be safe in your own body is dependent upon how much an insurer can extract a profit from you. And when people are in need, we waste time, effort, and money means testing, separating the worthy from the unworthy among those in need of help and then stigmatizing them instead of guaranteeing the basic decency of health equity. And for systematically marginalized people, sick people, homeless people, people struggling with addiction, people with disabilities, poor people, pregnant people, trans people, women, and people of color, when there's no way for the medical industrial complex to find profit in their bodies, then there's always the private prison system ready to receive them for profit. My friends, single payer is moral. Single payer is necessary. And single payer is achievable. Solidarity now, solidarity forever. That was my monster break. A lot of hours on the road, got my monster. My fucking de facto sponsor. Oh, that's the bummer part of the speech. All I've done is talk about what the fight is, right? Name the fight. I'm here to talk about how we win. You want to talk about how we win? So we're told this is just the way things are, right? And that, in fact, this is the way things have to be. We are told that universal health care is a pipe dream and that capitalist, corporatist domination of our bodies is natural, normal, inescapable, and irreversible, and that single payer will never, ever happen in America. And that's just the Democrats speaking. So what do, right? Well, right now, we stand on the shoulders of the labor movement, of hundreds of thousands of nurses and of tens of thousands of doctors who have demanded from us a clear and focused vision of the future, that insurance is not health care, and that health care is something a just nation affords all its people. And we've seen this vision written, for better or for worse, in 2 bills currently in Congress, one by John Conyers, one by Bernie Sanders, that offer us the basic framework, they're not done yet, but the basic framework in which we build the popular movement. Now, we got to be specific in our optimism, right? We live in a pretty bleak timeline. Things are pretty bad out there. For example, Aaron Rodgers is out for the rest of the season. Things couldn't possibly get worse. So I'm a Packers fan. I wrote that in on Saturday when I found out, and it was terrible. These bills aren't going to pass anytime soon, right? And when it comes time to discuss single payer, just the worst ghouls, the most insipid, flappy-jowled lapdogs of American capital are going to come at us with their fangs bared. And so it is our responsibility to fight. We must build the popular movement, which begins by demanding single payer from our government and then continues to demand health justice in our nation. And when people tell us that we're bringing about creeping socialism, that we're rejecting the American capitalist way of life, we say, yeah, no fucking shit. And we keep on fighting. And how do we do that? We gotta do that shoulder to shoulder. Now, I'm a proud socialist. I'm a proud member of the Democratic Socialists of America. And guessing by these guys' t-shirts, I guess at least a few of y'all are as well. Recently, our comrades across the country, from Oakland to Buffalo, Phoenix to Philadelphia, North Texas to upstate New York, have begun their work of canvassing to build a movement for health justice. Now, the idea of the canvass has been kind of poisoned by mainstream parties into this weird, tailorized Frankenstein, or more pedantically, Frankenstein's monster, focused just on like signatures and data collection, but that's silly. Canvassing is just talking to people, one-on-one, person to person. It's the foundation of all solidarity. Canvassing is just a conversation about a shared vision for a better world. I think there are few more inspiring uses of our time than rejecting the ways neoliberalism tells us to be afraid of our neighbors, right? By rejecting the idea that we must fear each other by divisions of race, class, age, or gender, because those are just the divisions that benefit those who seek to profit off our health care in the first place. If that doesn't make sense, though it sounds like it does, let me put it to y'all like this. How many of y'all have ever been, or know someone who has been, denied health care they needed or health care they wanted because of lack of funds or lack of access? Cool, keep those hands up. How many of y'all have ever seen someone you love suffer because they couldn't afford a doctor's visit, a prescription, or a surgery? How many of y'all want something better? Great, congratulations, I've just canvassed you, and I've radicalized you as my brothers and sisters and friends in the fight for health justice. That's literally all that canvassing is, right? That's how you build a movement, one person at a time. Our friends across the country, DSA just passed the Medicare for All resolution. We're building resource kits, right? We're building the idea of a canvas in the box. And we can offer anybody who wants to take on this fight the structure that they want, and provide them with materials, advice, training, friendship, whatever is needed. But the shape of the campaign, right, should you choose to fight for it, and I hope you do, is entirely up to you. Some places, like in the New York City Socialist Feminist Working Group, are choosing to enroll people directly in Medicaid or directly in the ACA as part of their broader health justice canvass. Some folks are pressuring local electeds, although I know it's a little bit tougher here, to endorse Conyers or Bernie's bills or sign on a Grover Norquist-style single-payer pledge. Some folks are just going to rural areas and either offering transportation, which is a big issue in outside Indianapolis, to community health centers, or handing out information about what healthcare resources are available. Some folks are taking direct action and building street medic teams to go out and try to help people find care when and where they can make it. So, and all these things are important, right? Because even though, as I said before, while the fight is national, healthcare and healthcare needs are local, right? So what healthcare looks like in Louisville is a whole lot different than what it looks like in Cleveland or Milwaukee or Houston. And so I come to y'all not only as a speaker, but as a student. I'm on this big road trip to go around the country and get super sweaty and talk about single payer and what it means. But I need to understand, and I want so badly to understand, how it manifests in the hearts, minds, and bodies of people across America. So please talk to me. When we organize, right, when we build this national solidarity, we carry our own needs and also the needs of those around us. And as I speak on behalf of single payer and health justice, I want to carry y'all in my heart, just like I carry everybody that I talk to in my heart, so I can understand better what it is we are fighting for from coast to coast and plains to gulf. Single payer is a relatively benign transformation, right? We're just changing like what Excel column a certain kind of funding goes into. But it begets a much broader revolution. By providing people the basic decency of health equity today, we build a movement towards a better and stronger and brighter tomorrow. In the 1880s, it was the unions that scared the shit out of Otto von Bismarck and demanded socialized insurance in Germany, and he relented. After World War II, it was once again the unions that launched national strikes to demand a universal health care, a single-payer health care in their nations. But now we live in the era of post-Reaganism, right, of post-Thatcherism. If a union member goes on strike, the first thing they lose is their health care. So unions have been made inadequate to take on this problem themselves. The only way we realize a better tomorrow is a popular movement. And I know it'll work because single payer becomes inevitable once we make it inevitable. And health justice becomes inevitable once we make it inevitable. I am so proud to stand shoulder to shoulder with y'all. Solidarity now, solidarity forever, solidarity, y'all. Should we jump right into Q&A?